The day that we found out he had cancer, pretty much knocked me off my feet.
Well, 2 years ago, I was diagnosed with cancer of the bowel.
Mr. Anderson was diagnosed with a rectal cancer that was already locally advanced, and his case isn't so much unique as much as it just typifies exactly how we approach individual patients. We have to look at the situation and treat them and their cancer based upon the presentation.
We're really fortunate here at Overlake to have a cancer center that's large enough to have the latest technologies and treatment modalities, but small enough to have the coordination of care that happens amongst the various physicians and care providers.
At Overlake Hospital, we have a Tumor Board that's a multidisciplinary approach to treatment of a cancer for a patient.
Weekly Multidisciplinary Conference is a chance for all of the specialists to get together in one room and talk about cases all at the same time, sort of in real time, usually before patients have had much, if any, treatment at all, and as a group decide on what we think is the best way to approach a particular person's case.
And then the presenting physician can report back to the patient what the findings and recommendations were. And that saves the patient a great deal of time from having to go from doctor to doctor to doctor to get all those different consultations.
The level of communication was really very straightforward. They outlined options of treatment, the one that they would recommend, and I basically went with what they recommended.
He was a great patient both during the treatment. He tolerated everything and participated and was open in his communication with us in terms of sharing with us what he was going through, and it made our job easier to take care of those problems.
When I was working with the radiologist and the oncologist, I told them that the surgeon I would want to have was Oliver Biggers.
He then underwent surgery and had subsequent chemotherapy based upon the findings at surgery.
And that worked very well for him. He had no complications from the surgery that way. And if you knew George and the fact that he is a can-do man with a great attitude, it worked well, and he's doing well.
One of the great things about receiving cancer care here at Overlake is that patient care is individualized. It's tailored to the unique needs of the individual patient.
I had never been through anything like this, but they told us what was going to happen and how they were going to go about it, and they were reassuring. I think a weight's been lifted off of his shoulders in the last few months as realizing that he's feeling better.
I guess my plans for the future in regards to cancer, as far as we're concerned, it takes a back seat. I mean, our lives, I don't feel like they've really changed at all.
I'm very grateful. That's such a great hospital is just down the block from me.